Hi guys, today I'm talking about a demonstration of malpractice and communication with healthcare. Working in healthcare means working with a professional standards to ensure patients receive quality care. However, when patients are faced with negligence in standards of care, surprisingly only a few patients will initiate a malpractice claim. Research has found that most patients are likely to initiate a malpractice claim if there is a breakdown in communication in the healthcare provider-patient relationship. Verbal communication is the most obvious form of communication and encompasses of words you use to communicate information to your patients. Using effective verbal communication with your patients is an essential skill for healthcare providers. By asking questions during your discussion with patients, you can ensure a two-way dialogue that encourages your patients to tell their story beginning out additional issues or concerns. Consider asking your patient open-ended questions such as, "What has brought you today?" Or, "Can you tell me more about your pain?" You could even ask your patients probing questions to encourage them to open up and talk, such as, "Is there something else you wanted to talk about today?" Other forms of verbal communication can also put your patient at ease when used appropriately. You can inform and educate patient on what to expect. Use humor where appropriate and check your patient understanding of any medical terms. Non-verbal communication is also just essential as verbal communication and act as a complement to the words you use. Consider maintaining eye contact with your patients or nodding while patients speak to suggest ability to attentiveness. Make sure you are not focusing on external distractions such as checking your mobile phone or looking on your computer screen while patients are talking. While non-verbal communication is used effectively, it can ensure your patient do not feel rushes or ignored. Empathy encompasses your verbal and nonverbal communication skill for patient understanding. Responsible and compassion and ultimately help your patients feel more comfortable to give their fuller histories. If you practice empathy effectively, you can facilitate trust and disclosure with your patients, which can be direct therapeutic. It's important that you encourage open communication about treatment preference so patients can make decisions for ongoing management that fits within patients' unique cultural context. That's all for my topic today. Thanks.